maybe we'll change the camera to the posterior camera, or let's leave it like this.
Let's leave it like this for now. Comment is if it's not a good looking picture.
Why aren't we seeing anything here?
All right.
Now.
Yes, we are live.
Hello,
we
folks.
We have liftoff. Hello.
Welcome to our first ever English international live. We have had few in Finnish, but never in English, and I am nervous.
I can't tell it. Hello, Newman Photos. Welcome.
And usually in these lives in Finnish, we have been talking about what we're gonna do in the future, and also people have put questions in the chat and we have answered it. Yeah, talked about it. What's our views about the problems given, and yeah.
So feel free to ask us questions about
anything.
Almost anything.
Yeah.
Maybe physio related, movement related, health related. That's our main thing, but yeah, we can speak about other things as well.
And do you hear us clearly?
Yes. Oh,
hello.
Very nice to see people from all over the world.
Montreal and Oslo. Greetings.
Yes.
All right.
Who is the first brave one to ask us? Oh, yes.
But first, before we give any advice or answer your questions, we have to disclaim or give a disclaimer. So no therapeutic therapist-patient relationship is formed via this live, and yeah, every advice that we give, follow at your own risk. We don't want to be responsible if you do something bad. All right.
So, Jacqueline, you asked that you had a cervical fusion. What can I do to help with all of the muscle pain I continue to have? Very good question. Do you want to take this or?
Yeah, I can take it. So you have fusion there. So movement from these fused joints is, there is no movement. So you cannot stretch that well. So the best thing for you, in my opinion, would be to release the myofascial system. So use maybe a stick to roll around your muscles, myofascia, use a tennis ball, and this will help to release the tension. Also, nerve gliding exercises are really great for this.
Yeah. Yes. And basically the upper back area is also really important because that's one segment lower, so this part of your spine here, so you can make some movement happen there. So in my experience, it's good to mobilize the thoracic spine. It's really important. And don't forget to strengthen your deep flexor and extensor muscles in the neck. Even though the area is still fused, it's good to have like some muscle activity going on, those deep cervical muscles as well.
Because you start to compensate with other like segments from the cervical spine. So those that are fused won't move. So the movement starts to come lower or higher. It depends what is fused together. So having good muscles, good stability in these segments will help to combat the excessive movement that can come. So it might get lax and because of the compensation. So it's good to exercise the muscles.
Yes, indeed. How did you recognize that nerves can be released the way you propose? Well, we didn't recognize this per se ourselves. We didn't do any like studies or something like that, but we studied this these techniques in our physio school way back when.
Yeah.
And we have used them as a part of our rehab programs with people with like sciatic pain or neck, upper limb problems. Very often they are very, very good. Of course, they are not the end all be all, but as a part of physiotherapy programs, they are really good.
To be honest, it should be basic stuff for physical therapists. It's long known about, and yeah, people have used it, but I think it's been forgotten because there been new stuff coming, and people are more focused on that, and they have forgotten the nerve release part.
You have maybe noticed that the healthcare and wellness industry in general, like there are trends, always something new going on, and this is the newest thing and the best thing ever. And when you do the
basic stuff
really well, those are usually the cornerstones to make things happen.
Somehow every new trend like pushes the old stuff away, and people only focus on that. So that's a bit sad, but true. And I do it also myself. If something new comes up, I try to think everything through that lens and want to imply it to everything, but that's not the case. There's no such thing that would work on everything.
There's actually like this kind of own term for it also, that for example like doctors when they go to like seminars and stuff, they learn something new, then they start to see everything through that. So I guess it's a part of human nature.
There's hello from Germany and Mexico. Hello back.
Hello.
Greetings from Manchester. Hi, mate. Hungary also, nice.
There's some new questions here. So I have a big pain in the right arm nerves from the neck down. Would it be okay to make exercises during this nerve pain? Sure. Depends on the exercises, of course.
Yeah. If it aggravates the symptoms, then no. But if you can do it and manage the pain while doing it and afterwards, it should be okay. But remember, all of our advice that is given here, do and follow at your own risk.
Yeah, usually what's good is to avoid like these huge movements, even if you are doing like nerve mobility exercises. One of the most common things that we encounter, I think, with our customers and patients is like they do the nerve glides way too hard.
Overdoing it, yeah.
They think about stretching when it's not like stretching in the beginning.
Yeah, you don't have. It's best when you don't feel anything while doing the nerve glides, for example. And also I have to mention that if you would please like to push the like button, it would help us a lot. Thank you very many.
Thank you.
Thank you very many.
Talk about nerve releases versus muscle release. Where to begin?
Basically, yeah, muscles like to be stretched and they want to be stretched from time to time, and nerves don't like to be stretched. They tolerate a small amount of stretch. Is it like 10% or 20%?
I think it was 10.
Yeah, maybe 10. And after that, because of the cross section, because it's like hose,
tube?
like a hose tube, the cross section gets smaller when you pull it. So when you stretch the nerve, the cross section gets smaller and the blood flow and metabolism gets hindered, and that's why you start feeling like this tingling and numbness when they get stretched. So that's the difference. But to be fair, when you stretch the muscle really hard, you also push fluids out of it, so it also doesn't want to be stretched too far and too long, but it tolerates it far more better than nerves.
Yeah, and when you think about, for example, those nerve stretches, usually you can like deduce if it's nerve or muscle if you know some basic anatomy, because, for example, the sciatic nerve and the tension is, or the problems in sciatic nerve also, is sometimes they mimic the tension in hamstring muscles. So you think you have tight hamstrings, but you have nerve problem. So how can you differentiate this problem is using this like knowledge that when you are moving your low back, hamstrings don't go to low back. So that's like one component. So you can like play with these different things. I don't know if I'm explaining it correctly right now, but
when you like stretch your nerves, then you know that the nerves ultimately go up to your brain. So the neurons go up to your brain. So when you move your head, you know that also the spinal cord and the peripheral nerves that go into your limbs move, and you can differentiate those nerves from muscles by moving your head, for example. So if you stretch your hamstrings and you move your head, and the stretch feels, you still feel the stretch in the same place, mid-center of the hamstring muscle, probably you don't have any mobility issues with your nerves, with your sciatic nerve, that is.
And also the like nerve stuff is usually a little bit more like widespread. For example, in the case of the sciatic nerve and the hamstrings, it's common that the symptoms are in the low back, they might be in the glutes, they might be in the hamstrings and in the calves and so on. So that's also something that usually makes us think that maybe this is a nerve problem.
I would like to mention that if you want to get our free myofascial release guidebook, ebook, manual, whatever it's called, then grab it for free. The link is in the pinned comments. I think it's up somewhere, or depends if you watch this on your phone or TV or laptop, it's in different place, but it's in the chat, the most up comment there, written by me. So go grab it. It's totally free.
Yeah, and also let us know if you are already on our
email list.
Yeah. And you have checked out this manual already. What did you think about it? Any like improvement suggestions for us? And also let us know in the comments that what kind of content would you like to receive on the email list.
Yeah.
We are really open for learning new things.
I was just checking your neck videos. You are super funny and professional at the same time. You are great. Thank you, Carmela Gonzalez Garcia. Thank you. And greetings to you. First question, is there any chance to win arthrosis?
I think this depends what you mean about winning.
Yeah. If winning is getting back all the cartilage to the joint, then right now, no. Probably in the future there will be some surgery technology or injections of sorts, but right now, no. But if winning means to get it pain-free and moving again, then definitely. And I've had really, really severe like arthrosis clients with knee pain, knee arthrosis most commonly. And yeah, with right mobilization and right self-treatment protocol, you can better your symptoms and do a lot. Yeah, but it needs work. It needs work. It needs daily self-stretching. It needs strengthening, and also it depends what are your like key weak points in the joint. So if you lack some muscle strength or do you just lack some mobility, you have to address those issues. But usually it's both.
Yeah, and I'm not sure what were the authors, but I remember from my studies in Jyväskylä University, there was this study that our professor told us about. I think he was part of the team, and they did this study where they
Was it like jumping?
yeah, it was like they started with this like really low level baseline movements, like really like small steps out of like this, what's the call, like step below the,
Yeah, from like
a platform, small
platforms,
platform,
yeah. Elevated
and
platform.
yeah, they did that for a while, and then they like small steps, they increased the load, like small, like tiny jumps, and from there on, and it was actually really good for the joints. So what's really common with arthritis is like the fear of like damaging the joints more by using them, but joints need movement, so you have to like intelligently, like Markkus told you, like design what you are going to do to like keep the joints moving, keep like blood flowing to the joints and stuff like that. So yeah, it's not game over with arthritis or arthrosis. No.
If you want your comment like to jump on the top and that we reply to it, then there's like this, what it's called, super chat or something. Then we can, of course, first answer your questions. There's a lot of questions here.
Is it?
Yeah.
Oh no.
Yeah.
Oh yes.
Oh yeah. I think we have to like a little bit tune up our pace. Hello from Slovenia. I solved problems with my neck. I'm very grateful. Thanks a lot. You are welcome.
You're welcome.
And thank you for watching our videos.
There was a question about
Carpal tunnel and cubital tunnel syndrome.
Yeah.
It depends what's causing it. Most probably muscle tension and also then the nerve mobility issues. So best would be to do sliders for the given nerves that are stuck. So I would do all three main nerves. So median nerve, ulnar nerve, and radial nerve. And I would do like stretches and myofascial release techniques. Our neck and upper body nerve release course would be good if you want it. Of course, it's paid, so if you don't want, you can search online for these exercises that I told you about.
Yeah.
Then
there was about the face muscle releases that we recommend. We have
a video on it.
Or
yeah.
2 videos.
For temporalis release, then masseter release here, and then pterygoid muscle release from inside the cheek. It's a cheeky technique. Yeah, but it's good video. Go check it out. It's on our, it's probably, you see it, the thumbnail is a skull. Hey, how do you guys like our new co-worker, Ludwig von Tutankhamon? He came us from German Amazon, so we named him Ludwig. He has to work hard or it's back to the graveyard for him. And he's not in a union, so he cannot complain. Hello.
My problems jump around in my right side. What do you...
Oh, hello back to Canada.
Yes, hello.
Victoria.
I'm not really sure. This means like
probably like
one time it's like upper body and one time it's on the lower body. Well, these are tricky situations.
There can be ergonomics involved. You know, your workplace, you have everything set up in like unilateral way. So your screens are here and printer machine is here and yeah. So it depends on the factors. It's really hard to answer this question.
Yeah.
But every answer that we give to you, follow at your own risk. Yeah. And hey, go grab our free guide to releasing anterior and posterior myofascial chain. It's a good way to release muscle tension.
Yeah, and maybe to the that question about the right-sided symptoms, when it's like this kind of situation, it's almost always the best to like get a good physiotherapist or someone like that you can work with, so they can check the situation and give you more like specific answers. Yeah. Thank you so much for your explanations. I have experienced immediate relief with your exercises, and I wonder why this is not more popular. I'm not sure what exercises you used, but you're welcome. And of course, some things like should be more popular or should be common knowledge, but they aren't. And that's also part of why we do this thing that we do in YouTube and in other places is like share the knowledge.
Yeah.
So it becomes more common.
Yeah, and also people can, fix their problems themselves and they don't have to go anywhere. So that's also good because the accessibility of healthcare isn't always as easy as in, for example, in Finland, and even here it's getting more harder and harder to get to to the right doctor and in a timely manner. So
yeah, and sometimes what I've seen is like you are expected to learn certain stuff in like education in like, for example, in physio school or whatever, and the tests or things that we look or the teachers look there is like it's not superficial, but it's not like really on point, and then you just learn some things and some things you don't, and then you go into the wild and be a healthcare provider, and then you don't know and you should know, but you don't, and that's that.
I've learned the most like when I was in physio school. The most I learned in like clinical practice when we had practice.
Yeah.
I went to the sorts of places that I would want to work at and then try to learn there, and from like my own, when I read books after school and that were related to physical therapy, I learned so much more than in the school from the teachers and professors. So yeah.
Actually this was a part of my master's thesis. Actually one of my what's it called, like interviewees.
Interviewees.
He said like that because of this like clinical practice thing that Markkus was talking about is like really huge part of your learning process, but then you like don't get a good place to go, or you don't have like a good teacher on the like clinical like setting, and then you don't learn it. So it's really like vulnerable. I don't know how to say it, but yeah.
It's like the word squirrel.
Yeah.
It's impossible.
Yeah.
I have persistent SI joint pain. Any ideas on a fix? Yeah, it depends. If it's right in the SI joint, then and it's inflamed, for example, then a doctor can put like corticosteroids, cortisone injection there, and it's done. But if it's like more functional issue, then most probably you have to go see somebody to check the imbalances of muscles, and if there's any like really, for example, really tight hip flexors that are like twisting and turning it, or there might be several different imbalances. We have also one video on SI joint mobilization, and I've also talked, if I remember correctly, I talked a bit about the stabilization also there, so go check it out.
Yeah, that's a big part. People often like concentrate on mobility techniques when they should be like activating the muscles, like for example glutes and the oblique abdominals. Yeah, it's really important with SI joint as well.
And hellos back to Iceland and Rotterdam.
Hello. Rotterdam, I've been there, but not in Iceland.
And Denmark.
Yeah.
I've not been there. I've not traveled so much. I've been to Japan, States, United States, Croatia, Italy, and Greek, and Germany, Sweden.
Yeah, but
Latvia,
definitely love to
Estonia.
go to those places as well.
Yeah, Iceland sounds, and also Denmark, and
But
the Netherlands.
even though they're close, I've never been.
Yeah,
Been to Sweden and been to Norway.
Iceland's not that close.
No, that's not close. Yeah, that's true.
Question: I am 60 years old, and 3 years ago I discovered a fantastic joy of gymnastics. I've been working hard. Angel emoji. What stops me is lifting arms above head, as in handstand. No much progress. Tips? Okay, handstand, it's art of its own. There are great tutorials, I think, on YouTube. I suggest checking them out. But if it's a mobility issue, then yeah, just every day grinding the stretches would be super necessary. So stretches here, also latissimus dorsi stretches, so palms up like this, stretching and keeping your low back glued to the wall, for example, really good. But I think it has a lot to do with the core balance and also with the scapular balancing. So I think there are great tutorials. I've seen some. I never do it myself, but yeah, I've seen stuff. Greetings from Italy.
Yeah.
Greetings back. I loved Italy. Loved Tuscany.
It's a cool place. Yeah.
Really nice.
And also with the lifting arms thing and like the muscle activation part, like I spoke about earlier, it's not all about just stretching. The activation part is key. Often with gymnastics, there's lots of big movements and it's like really hard for the stabilizing muscles. So that's also worth doing. And also I have to mention that
press hard.
Yeah. Also I have to mention that when we are answering your questions, and if we like miss some details or something like that, just send us a new message and we will get back to you. And these like short messages, we don't get like this like really detailed like view of your situation. So our answers are somewhat vague.
I'm a rolfer and have been recommending your videos to my clients. Thank you. Thank you. You're the MVP. I really appreciate your emphasis on doing in a gentle manner. So important. Yeah, it's important, but also in myofascial release, I think you rolfers do like more gentle stuff than we do. We are quite hard on the myofascial structures in our approach, but I think we both get great results. And also, yeah, thank you for recommending our videos. It means a lot.
There was unfortunately a situation where our courses didn't help you. We are sorry to hear that, and you can also like send the message to like their or Movement World like email. Info.
Yeah.
Ask for more details there. Or...
And I hope you asked your money back, because we don't want anybody that doesn't get help from our courses to have like paid for nothing. So I hope you asked it back. And I'm sorry also, it doesn't work for everything, and there are lots of factors that are going on when you have these musculoskeletal issues, and we cannot address them all by online course. So yeah, sorry.
Yeah, we are sorry.
Hi from Uppsala, Sweden. I do your exercises almost every day. It really works. Thank you. We are so happy to hear.
How many seconds should you stretch? Well, this depends.
Some studies have shown that 2 minutes is good.
Yeah.
But yeah, it depends.
Sometimes we use this like 30 seconds 4 times, like intervals, so you don't like keep those really long stretches. For example, in situations where you have like lots of pain or something like that, you need to start with more gentle stretches, and and not overdo it. Yeah. Saphenous and femoral nerve stretches are giving me relief, but still have tight adductor. Brasilis maybe. Pain sometimes moves around. Yeah, maybe have you worked on your adductors?
Yeah, like strengthening them.
Yeah, that's also often really like forgotten thing.
Maybe you should start with like isometric. So put some, like, for example, a football ball, not the American one, but the European football between your knees and press them together, and then knee straight. Also put it between your heels and then push your heels together.
Maybe we have like this exercise in our Instagram.
Instagram, yeah. Follow us on Insta also if you haven't yet. It's the same movement
mandatory ad break.
Yeah, mandatory ad break.
Thanks, guys.
Everything at your own risk.
Thanks, guys. I own most of your programs. They are all great and very helpful.
Thank you.
Thank you, and we are really glad to hear
Tomo arigato.
Mr. International.
Could it be that simply your nerves don't stretch? Yeah. Nerves stretch just a little bit, so stretching them is not that great, but for example, in our course that is done in Finnish, it's like the original nervous system release course. We go deep into also the nerve stretches, so we start to tense the nerves. So we, after the movement has been normalized, we start to take the nerves into a stretch for a short period of time so that they can start to tolerate stretch. So that's also a good part, like that's the final part, but we didn't include it in the nervous system release course because, you know, it's a quite compact course. So
this was something that I noticed down the line on the comments. You can watch this later also, this live event.
And put thumbs up so the algo will recommend this to other people as well.
Once again, hello from Sweden, and I have an incomplete SCI at C4, C5, broke my neck, crashed my motorbike, I think, and have walked unaided since my injury 4 years ago. I have much reduced sensation from the neck down. Sounds rough. And those SCI? Like, yeah, I'm not sure either. Maybe some kind of
Let Gemini tell us what it's.
Yeah. But basically, what I can tell about like
spinal cord injury. Oh, right.
Yeah. But what I can like talk about like motor vehicle accidents in general is like whiplash things are really common and often misdiagnosed. So you might get like, I'm not sure if this is your case, but you might get like weird dizziness or like neck pain, chronic neck pain from like car accidents and stuff like that. So it's always a good idea to follow some kind of whiplash protocol for your neck after injuries. But of course, spinal cord injuries are like a thing on its own, and we're not really like super familiar with those because it's like a different area of physiotherapy in Finland.
Yeah, we're more like in the musculoskeletal system, and the physios who deal with spinal cord injuries, they are like neurological physiotherapists, so they deal with like spinal cord injuries and like what's called brain hemorrhage patients and stuff
Parkinson's
like this.
Disease.
Yeah, like this.
Yeah, MS disease, stuff like that. Yeah.
Left arm,
right. Good luck for you to Sweden
and good that you have been able to walk unaided now.
Yeah.
Left arm okay, right arm less extension.
Extension meaning what?
Maybe this.
Maybe this.
Maybe elbow extension
or
palm extension. But yeah, people are like different sides are a different pair. I experience a lot of muscle tension and teeth grinding during my sleep, also because of perimenopause, and I suffer from PTSD. Can I do something to pretend it?
Maybe prevent or treat it.
Yeah. Yeah, like relaxation exercises would be like, I think the best here. Deep breathing exercises before sleep, also during the day, I think. And then slow paced aerobic exercises, and also slow, like for example nervous system release exercises, doing slow stretching exercises, mobility exercises. They are shown to be effective in reducing stress. Also hard exercises, sometimes you need to do heavy exercises. So yeah, overall breathing techniques, stress relief techniques, and exercising would be, I think, the best.
From a physio standpoint.
And also releasing the muscle tension from your jaw would be good, and upper neck and neck, shoulder region, and everything at your own risk.
And also don't be afraid to ask for help with the PTSD things. Maybe you have done so already, but although it's notoriously quite difficult and long process to treat PTSD stuff, I'm not really super familiar with these things, but get help and treat that.
And also perimenopause. Probably if you go to a doctor, she will prescribe some hormonal treatment also, if it's the cause or reason for this, I think. Being pain-free is a win. It truly is. Carmela Gonzalez Garcia, I'm on your email list and have bought 2 of your courses. All the information has been really useful so far.
Thank you.
Thank you.
Good to hear. And also for all our email listers, if you have some like suggestions, what kind of content would you like us to do for the list, please let us know here or send us message elsewhere, whatever floats your boat. And also what kind of YouTube videos and subjects would you like us to do next. We have something cooking for Christmas, but
I think we can spoil you. It's myofascial release for the low back. So basically the same that we did for the neck, but now it's for the low back, and it's the lateral chain. But go grab our tutorial for unlocking your myofascial anterior and posterior chain. Hello from Croatia. Hello back, Croatia looks super fine. I've been there once. Super fine. I loved it. Is there some food to
avoid? I will wash my hands out of this, not my expertise.
Basically healthy food is good. So and like electrolytes and vitamins and nutritious food, and also like keep yourself hydrated. Basically, it's good for your fascia. The feeling of everything popping.
Our thoughts about supplements as glucosamine, magnesium, collagen.
Well, magnesium super important, of course, for muscles, and glucosamine. Maybe, I don't know. People take it for joint health. Cannot comment, but magnesium is really important, and that's like vitamin D3. It's really important. So
this is also a little bit out of our normal expertise, but these are like things that is often best talked with your doctor. I know it's sometimes hard to find a doctor that you can work with for longer periods of time, and we will want to like take your overall health into consideration. At least in Finland, usually it's like, come here, take this test and leave. Type of stuff.
Take ibuprofen and get out here.
Not for the doctors.
They're in a hurry and they have short.
It's a systematic
systematic
problem in the healthcare system. So we love doctors and all the
Yeah.
healthcare people equally here.
Yeah. I'm taking pregabalin for nerve pain. I have recently started, but it is causing a lot of muscle and joint pain. Should I stop? Consult with your doctor. Sometimes it's really necessary to get the nerve pain out of your system with pregabalin, if nothing else works. Thank you for all that you do.
Thank you for your kind words. It's nice to hear. And also hello to Portugal.
Want to visit Portugal.
This is like a checklist, all the countries we want to. That's a nice
I want
country,
to go to Porto or Lisbon.
Cheeky technique.
Yeah.
Thanks. Markkus is our resident joker here.
Yeah, I throw my dad jokes around. I didn't solve, but I am way better with your course. And told some friends, is there any beer for extra lower customers?
Sometimes it's not like possible to get all of the problems away, but it's a good thing that you get some relief, and then you can do some other stuff that can take the situation further. And also thanks for the recommendation for your friends. And I don't know if we have any like plans to start our own brewery, but yeah.
Movement brewery.
Yeah, Movement Brewery. Ludwig's Brewery.
Ludwig will be our head brewing master. I have numbness and inflammation and 2 trigger fingers in each hand. Can this be fixed? Really hard to say. It all depends on the severity and what factors go into it. So it's really hard to say, but I think you should try at least. It either works or doesn't, but it's worth rehabbing.
Jerks in your neck and up in your head, intense tension, and feels like brain is doing a 360 inside your head. Have a pinched nerve in your neck. Do you think jerks come from that, and what to do? Well, I'd say that maybe see a healthcare professional. This is not like a typical symptom that like
maybe needs to be assessed by a doctor if there's anything more like
not to be alarmist or anything like that. Don't worry, but it's best to
just to check it out. If there's any compression anywhere, it might be worth a while to check it out. But it can be some nerve pinchment and
maybe
mobility
on
movements.
The upper neck.
Yeah, mobility movements can help, but everything at your own risk. Hello from California. First one from the USA.
Hello.
On the line.
First one to tell us.
First one to tell that they're from US of A.
US of A. Welcome, welcome.
Someone with cervical spinal stenosis. That's unfortunate problem to have. I love your upper body stretch. Helps me from being stiff in neck and shoulders. Recommend it warmly. Thank you. Thank you. And everybody, go grab our free myofascial unlocking tutorial. It's free. It's a PDF, so download it and then you can check the techniques. Maybe we'll have a course someday on it. We have in Finnish, but we don't know if we get the green light for it in English from our
partners.
Partners from Movement World. They host our courses and market our courses. A big thanks to them also.
Yeah. And also there was another question about cervical stenosis. Is it safe to do medial nerve sliders? Yes, it is. And usually it's really good, but maybe be mindful about the pain if like compressing on the affected side is like painful, then you can do those like hand movements with your head stationary as well, or with just like these really small movements, but then keep the hand movements like with a smaller range of motion, so no like stretching or pain should be felt, and then usually it's okay to do them.
Everything at your own risk.
Okay.
I'll take this. Poor Ludwig. Does he get on your nerves? He does not seem to have any. Well, in fact, Ludwig has nerves. These yellow ones that are cut are Ludwig's nerves.
That's why he's like this limp person.
Yes.
Yeah, he doesn't. He's actually like our new favorite thing here at the office.
After our plant got some, I don't know what, they're like some bugs that chew on it. We have now like poisoned them away. We have to be cruel, but yeah, we try to save our plant, but it's not as bushy as it was before. So now Ludwig is our main prop. But we also use
that's like the oldest plant we have. It has been here since almost day one.
Yeah, day one.
Like
yeah,
5 years.
Yeah, but now it has some parasites or something, but I think not anymore because I've been really heavy on the poison.
What are the best exercises for sciatica that's caused by L4, L3 disc bulges?
Sciatica L3 okay. So basically, I think that it also depends on the movements that aggravate it and what like aggravates the bulge. Sometimes it's lateral movements, sometimes it's flexing, and rarely, but sometimes it's extending. So you have to minimize that for a while and then do the sciatic slider and then start to rebuild your core stability so that you don't like aggravate it and can do like multi-dimensional movements like in a good stable manner.
Yeah, I think
at your own risk.
Yeah, probably the most important first step is to like identify those movement directions, what's like bad and what's good, and modify your behavior and your movement accordingly. But also remember that you cannot forever avoid movements like bending forward from your low back. So you should also, when the time goes on and you get better, like strengthen those weak movement directions as well.
Yeah, so if the flexion, like bending forward is painful now, it won't be forever. So then you have to like start to do that also eventually. When the nerve calms down, you start to little by little progress and also introduce the flexing movement. But you have to do it in a good, stable manner, so no overflexion only, and you have to have good range of motion from your hips as well and from your upper and mid and lower thoracic spine, not only your lumbar spine. But yeah, that's what I think.
Best exercises, that's also like
it really depends what's causing
there are
it.
some like stables, like for example, like
sciatic sliders,
and like bird dogs are usually good for almost all of the sciatic issues, and
But in our sciatic pain relief course, in the first section, there's the first aid kit for really flared up sciatica, but then there's like the movement tests that you do, and according to the test results, you go to the right category of your exercises. So if the flexion is painful, then you choose the flexion path and you start to do exercises according to it, to your movement test. So yeah, we have taken this into account in our course, and sciatic pain relief course. I appreciate your humor and your knowledge. It's been very helpful. Thank you for the kind words. Most USPTs are focused on stretch and strengthen in an outdated way. I don't know why. Well, I think stretching and strengthening is also really important. We also like prescribe a lot of strengthening and stretching exercises. It has its own place and it's really, really important. Sore sacrum.
Sore sacrum.
Oh, if your sacrum is sore, I heavily recommend seeing a doctor just in case, maybe an X-ray, just to be sure that there's no fractures there. I don't want to be an alarmist also, but it's just for your own safety to check it out. If there's nothing, probably nothing, but better to be safe than sorry.
But does this like mean SI joint?
And sacrum is sacrum.
Yeah, but
sacral pain, sacral pain.
Yeah.
Because for example, my grandma had a fractured sacrum, so that's not good. And I have patients that have had sacrum, like what it's called, like strain fracture, stress fracture of the sacrum. So
yeah, and when you have done that, we also have like one YouTube video about SI joint pain, and then you can maybe use that afterwards.
Yeah. Really tender jaw muscles.
Sometimes like I get confused where I was on the list.
Which is most likely causing my frontal plus temple. Do you reckon I should go to a TMJ specialist dentist or myofascial repeat? If you can, all of those, but first I would say TMJ specialist and then maybe myofascial release PT. I think that would be a good combination, a way to go. What does it mean when whole body is popping on every
popping
movement?
like it's hot? Yeah, normal sounds of.
Now we get a copyright disclaimer because you.
I am so sorry. Please don't.
Or copyright strike.
Yeah, that's that.
Like inside popping and
that if it's not painful, it's like normal sounds of like joints making sound. It's quite okay. My joints pop, and I know your joints pop.
They pop a lot
all the time. Sometimes I want them to pop. It's fun. It's okay. But if it's painful, then maybe see somebody who can like manually assess the situation or make you move a certain way and see what's maybe a cause for that painful popping, but usually it's okay.
Hello from Ireland. Hello back. I love Guinness. And this is not a paid sponsorship, by the way. But if somebody knows somebody from Guinness, then let them call us.
Sometimes I think that these jokes are like really spot on for a health channel, like Guinness or nicotine-laced vodka energy drink.
We had our fake sponsorship with nicotine-laced vodka energy drink, so that was that. Maybe one person laughed at it.
Somebody actually complimented your editing skills. It's Markkus who is editing our YouTube videos, so yeah, you have noticed them going up, and so have I, and Markkus is the reason for that.
Thank you.
We are too self-made man.
We are too cheap to pay for a professional. That's the real reason. But truly, I think the real reason would be also that we don't we want to ourselves see micromanage it. Yeah, what's important and what's not. Where do we want to zoom in? Where do we want to zoom out? What arrows where? What should be highlighted? Because if you get somebody who's not a physical therapist and he starts to edit these videos. Probably he doesn't know what's the main thing to focus on if we don't heavily like micromanage him or her, and nobody would like that. Nobody would like me to micromanage their work, I could say.
Maybe we will teach you to edit.
Yeah, we will infuse Ludwig with ChatGPT and
That's the end of the world.
end of the way. Skynet activated.
Thank you for your honesty. It's wonderful to have genuine, qualified physiotherapists helping people understand what they should be doing.
Thank you.
Thank you for your kind words. It's really nice to hear. And on that note, you are showing a lot of sisu in grappling our strange English language. Yeah, sorry for our attempts.
Yeah, like every good foreigner that or like non-native speaker, we also have to apologize for our English.
For absolutely no.
Yeah,
For
but yeah,
everybody.
the grammar isn't probably the best, and the pronunciation isn't the best, and so on. But we try our hardest, and we hope you understand what we are talking. It might be mumbling, but luckily we have subtitles nowadays under our videos.
Yeah, we are approaching the 1 hour mark. We are probably here for another half hour.
Yeah, because we are not sure if we're in Finland, in Helsinki, and now the time here is like 10, soon to be 10 o'clock, 10 p.m. And we are not sure if the alarms go on 11 p.m.
Yeah.
We are not sure because
Maybe
at first it was, but then the receptionist said that it's not going on anymore. But now there's no receptionist anymore in this building. They don't work here. It's when this whole place went automatic, and now we don't know if it will go on or no. But we don't want to take like 2,000 euro fee
if you would
for
like
getting
us,
security here.
Doing some experiments, what happens at 11 p.m.
Welcome to Jackass.
And down the rabbit hole we went. That was a joke. Yeah, sorry. How do you identify where a nerve is pinched? My vagus nerve, I think, is pinched somewhere in my shoulder, neck, and I jerk in my sleep.
Vagus nerve is really hard to determine if it's pinched or not.
Because it's like
it's cranial.
Inside,
it's a cranial nerve that goes deep.
Yeah.
So it's really hard to know. But usually, I think you would have like sympathetic,
symptoms.
Higher resting heart rate and stuff like that. Problems with your intestines and But I'm no expert in like vagus nerve. I just know that breathing exercises and stretching and moving your head, mobilizing your head will also mobilize your vagus nerve and stimulate your vagus nerve and cause the parasympathetic nervous activation to go up, which is good if you want to rest and digest and heal.
But in general, the other like neck nerves, you have specific tests for those.
Yeah,
the mobility of those nerves that go into your arms, into your legs. So you can do those if this is like just one nerve that you are suspecting, and maybe others as well. So
people ask a lot about nerves, but not that much about myofascia. I'm surprised somewhat. But I think we are happy to answer nerve-related questions as well.
All the questions are welcome. Come as you are.
Yes.
How do you relax since emotions get your stiffness, it seems? Are you asking how I relax, or how do you relax in general?
breathing techniques, I think it's
Yeah.
it's like the best hack. Breathing techniques is like the fast shortcut, but in the end, I think you have to work with your mind.
Yeah, I was just about to say that that's also a key ingredient. If you are like always worrying, always thinking about what would go wrong and what is like wrong in your life or in the world in general, you will get like super stressed out and then you are in the loop. So breaking that loop is like the key ingredient, one of them, but it's also easier said than done. In my experience, it takes like a lot of maybe mindfulness practice or something like that could be helpful. I don't know, get some coach to help you with that.
Yeah.
Access our free online course. I don't think we have a free
but we
online
have
course.
free tutorial.
It's up there.
It's up there, I
comments.
think, or somewhere there or there. It's in the comments. It's like you see our name, movement maintenance. It's in yellow, and then you push on that, and the comment will show, and you get the link there, and you can grab it.
What does that joint popping when you rotate your shoulder mean? Once again, we are boring as something. It depends. It could be like some of the joints in the area. There are many joints in the shoulder, not just the shoulder joint. There is like AC joint and SC joint in the middle, and then the glenohumeral joint, which is the shoulder itself. So it could be that joint. It could be like some of the tendons there.
Tendons going over like bony landmarks. But the joint popping itself is basically a nitrogen bubble collapsing into itself or form. It's in fact it's now they've talked that it's when the bubble forms into your joint. So your joint moves and there comes space. So the was it nitrogen that's like liuennu? What it's in? It's like
help us computer.
Yeah, it's solvent. It's like solvent. The liquid there, and the nitrogen is dissolved there in the liquid, and then when the joint like gets more space, then the nitrogen forms a bubble, and forming the bubble causes the pop.
Somebody came to our rescue in the comments. Dissolves.
Yeah, thank you. Hello from Canada. I have few of your programs. I love them. So helpful. I'm 73 with number of issues, but thanks to you, I'm feeling much better. I'm currently dealing with a rotator cuff issue. Thank you very much for getting our course. Also, check our YouTube videos and subscribe to our channel if you haven't. We have a lot on rotator cuff. We have short videos on rotator cuff, and we have like 2 or 3 long videos on rotator cuff. So definitely check them out. So everybody, if you haven't subscribed to our channel yet, please do so. You'll see more of our videos then on your For You page or whatever it's called on YouTube. So yeah, and thanks for every subscriber. It would be lovely if we got to 100,000. We have 40,000 to go, but it's our goal to get 100,000. Then we could say that we are YouTubers.
Yay.
We are like PewDiePie.
Close.
Or Mr. Beast.
Yeah.
We are the bald Mr. Beast from East.
Yeah. There was a comment about the PDF. Did you find it? It's on the top of the comments, pinned down.
Should I comment it all again? Like
maybe
go grab it.
Just wanted to add, thank you for taking the time to answer all of our questions, and greetings from Galicia, Spain. I know I butchered that word, but it is what it is. Don't speak Spanish, but would love to visit Spain as well.
I've been to Mallorca.
Wow, Mr. International. Yeah, thank you. Thank you for your kind words. We are happy to help.
Yes, really happy. I put the tutorial now, I linked it again.
Now, give Ludwig something to eat. He seems a little bony.
Yeah.
Yeah.
He hasn't eaten since the Second World War or something.
Yeah. Maybe someday, maybe someday.
Or maybe even further back. Oh, our friend Säkkinen.
Oh, hello.
Janne Säkkinen.
Hello, Janne.
Hello, guys. What videos you have next coming, and is your editing skills gone up with those animations during videos? Because they rock.
I think this was actually the comment I was talking about.
It was Janne.
Yeah,
Thank you,
thank
Janne.
you, Janne.
Next
A
will
fellow
be
YouTuber from Finland.
Yeah.
And Physio.
Go check Janne out. PT Sakkinen.
Hello from Budapest, Hungary. I would like to have a new course on general stretching. I guess many of my back, hip, leg problems come from stiffness. I love your style of teaching gentle movements. Thank you. And maybe we will try out this course.
We are doing
a YouTube video, maybe.
Okay, yeah, maybe. And we are also doing a new course in Finland, so maybe we will translate it. Yeah, maybe.
Yeah,
let's see.
Yeah. Thanks for the suggestion.
And if you're not on our nervous system release course, then grab that one, because that's like general mobility course that has like nerve mobility thing to it. So yeah.
Your English is great, and I find it quite wonderful that you are doing this for free on your Sunday evening. Thank you for everything.
No problem.
Sunday is a fun day, and
Sunday is fun day. Yeah. My wife is home with my children, and I get the free night here.
And now, when she's watching this,
I think she is not watching.
There is an angry lady there now.
I think no, she's watching Dancing with the Stars or something. That's why we don't have many Finns over here, because Dancing with the Stars was on the TV at the same time.
Is it possible to do a sciatic nerve gliding in standing position? If so, how? And
yes,
it is. Yes, it is. For
example,
example,
can show, or Ludwig maybe.
Maybe Ludwig or maybe me. Let's see what happens.
Best physiotherapy channel ever.
Oh,
thank you, mate.
Thank you. That's saying something.
And their name is written in Cyrillic, so spasiba.
Ludwig, can you move, please?
Hello from Germany. Your programs are very helpful. Thank you.
Ludwig is going down. Can you see me? Yes, you can. For example, you can use this like Swiss ball with as an aid, and then my head is outside. Pretend I'm standing normally, and then when you do this normal like sciatic nerve gliding movement, you can do it standing like this.
Yeah, and when you extend the knee, then pull your head back, so give slack to the nerve. Joo, näkyy. You can see it.
Okay.
And yeah, it's at your own risk, of course.
And you can do it next to a wall, because when you are standing on one leg, don't like fall down. Yeah. That's one way to do it. Basically, you can do it without the ball, but it's nicer to move your leg when you have the ball rolling. Yes.
Hello from Germany. Your programs are very helpful. Thank you. Thank you. You are welcome. Hi from Scotland. You are the best. 6 years ago I had 2 operations on my foot. Now it has affected my entire body. Stiffness and pain up to the neck. What would you recommend? Yoga or Pilates? Kiitos. Thank you for your kind first words. And I would say both, I guess, would be best. You have to get like strength. Only stretching doesn't work. Maybe in some yogas there are some strength works, I don't know. But yeah, you have to strengthen. It's really important. Only mobilizing doesn't work. You need to have both. So I would say do one and one, and or alternate them. Do like yoga for 6 months and Pilates for 6 months, and also basic gym workouts are really good, really effective.
This is a trick for us, and we will fumble our words, but the grammar is grammaring and the pronunciation is pronunciating.
Your English.
Your English perfectly. Thank you.
Thank you.
As you can see.
Your English is part of the reason I love your videos. You have a voiceover in some, and she's awesome with warm, engaging voice.
Oh yeah, the automatic, yeah.
What automatic? Do you mean our like
the dub in the YouTube videos?
YouTube dubs, or I think Maren is referring to Movement World's some course, you know, where not our course but Movement World's course where Kalle is showing, and then there's
probably
lady, we don't even know her. I think
it's a bigger team, so we don't like know everything that's going on.
So for clarifications, Movement World is a company on its own, and we are not the owners or workers or anything. We are like in a collaboration with them. We do some courses for them, and they market us, and we are in a really tight collaboration, but we are not like owners or anything. So they have also their own courses with different people, and we are just some creators doing courses for them and AdWords for our courses. So yeah, we are not, the movement maintenance is not the same as Movement World, but we are in a high and tight collaboration. Must be going Italy-Norway qualification soccer game. I think I know who's gonna win, unfortunately. Where are we?
Yeah, I also missed. The source is there.
How long do I have to wait before lifting heavy after a hold in lower back? Only have some stiffness left. Unfortunately, really hard to say. Everything is so individual. It's, you know, we don't know the stage that you're in and what's the injury and like this. So unfortunately, we cannot answer that. I think you should ask if you have your personal physio who has worked with you, or your doctor, for the best answer. Do you guys go cold water swimming?
Not so much.
Not so much, but sometimes after sauna, yes.
It's
really nice.
Yeah, really nice.
But now, well, yeah, we went to Lapland and we had like the river going through the garden yard or something. Then it was nice, like from the cottage sauna to go and dive in the river and back, and again into sauna and back. It's really, really nice.
Thank you for your constant customer support, especially with extra demanding customers, and good idea this live session. Yeah, it's like it's really nice to hear about different like cases and how our courses are working and how our videos work. Sometimes it can be like you said, like a little bit demanding, but it's also rewarding when you hear like comments like this. It's really, really, really nice.
Yeah. And hey, subscribe to our channel if you haven't subscribed yet. It means a lot to us.
And we are probably here for another 15 minutes, so you can ask us
Approximately
still.
15 minutes, yeah.
Yeah.
Good idea. Neck and back morning 5-minute quick routine.
There was a question about scoliosis in the chest section. Could your exercises help prevent pain? She has to get chiropractor treatment now and then. Much tension and tense trigger points. Again, what do you mean by exercises? Which exercises are you talking about? About the online courses or some of our videos? And if it's a mild scoliosis, then usually you can get lots of relief from moving correctly, like using the right exercises. Maybe opening up the tense trigger points yourself at home using like tennis balls or something like that. Sometimes maybe the nerve exercises can be helpful, maybe not the first thing that comes to mind. Maybe the neck and upper body nerve release course has some good exercises that I can think of.
For scoliosis?
Yeah. Maybe some of the like erector spinae.
Erector spinae muscles,
yeah.
Rotational movement
and
from the upper body.
scapular things can also affect. It's not a spot-on course for that, I would say.
Can you take a video of a routine in the morning for the neck and upper back, please? I think tomorrow morning we are in a hurry, but yeah. But yeah, we can. That's a great idea. Morning routine for the neck and upper back, and also for maybe our email list.
Yeah, that would be nice.
And there's a neck thing coming up.
Yeah, neck thing is coming up next, I think. Maybe next or
week after
next week or the week after that.
Yeah, so subscribe. Go when you go and grab your free manual for the myofascial release. You can also subscribe to our email list, and then in the future you'll get awesome stuff like the routine for neck and back.
What is your professional opinion on barefoot shoes and exercises? Any tip to improve feet mobility or health? I like barefoot shoes a lot, been using them for many years, but they are really like intense for your feet when you are used to like these normal shoes.
Feet, yeah.
So begin using them really sparingly, like maybe a 5-10 minute walks on your day, and then use the normal shoes and gradually increase the load or the amount of time you use the barefoot shoes. And we have this like great tension opening exercise tutorial video on our channel. That's something I use on my own legs and on my patients. I've been using like combinations like that found on the video. So that's a good stuff for your feet. Did we have any other like ankle feet related?
Yeah, we have ankle related video that shows you how to first of all determine if your ankle joint is the issue or if your calf is your issue limiting, and then what to do about it. But yeah, I would also say the same thing, that barefoot shoes are great, but you have to slowly go into it, so not throw out all of your other shoes and only walk barefoot, because it can be really heavy.
Yeah, I think it's like a funny indication about how our modern sedentary lifestyle is like taking away our movement capacity in some sense. You can see it really clearly in your feet when you are start to like using your feet and you are like, holy hell, this is so like tense and painful. And yeah, but your feet get used to it, and that's a cool thing.
Thanks guys, I'll definitely share your channel with my followers. I'm on a Canada-wide health forum and have about 4,000 followers. Not much, but if a few of them subscribe, it will help you. Thank you very much, and 4,000 is a lot.
Yeah.
It's not easy to gather.
No.
Yeah.
It definitely isn't.
Yeah, good idea. Neck and back morning, 5-minute quick routine. Thanks a million for all your work.
Thank you.
Thank you for watching us and supporting us.
I like this question. But do you also have your own movement maintenance headquarters by yourself in Finland? Yes, we do. This is the place.
It is here.
And it is an awesome headquarters indeed.
It is here in Espoo, Niittykumpu.
I would show it to you, but I'm not
But
sure
we
if
cannot.
I can.
You will all unfollow us. This is a mess right now. But of course, when clients come, then we tidy it out.
Yeah.
So
And usually we just take all of the stuff on the room and you move it on the other side of the room.
and then we
and then
film
this
here.
This is the
And this
screen.
This wall is getting really dirty. We maybe have to wash it or something.
Yeah. Or Ludwig.
Or Ludwig can wash it. Or
Earn your keep.
Or just where there's dirt, we put Ludwig in front.
Oh no. Error.
What error?
Is it going still?
What has happened?
Oh no.
We want
to see the mess.
Can you still hear us?
Can you hear us? Can you hear me? Can you hear me? Can you hear me?
Okay,
Yeah,
now we're back.
Did you hear us, or we want to see the mess? No, you really don't. You really don't.
Your nerve release exercises have been a life changer for me. Really happy to hear.
Really nice.
That's why we do it. We want people to get better.
And that's the the fun part. I think it's not like you have to invest these like thousands of euros or dollars or whatever dineros. Yens.
See.
On like high-tech gear or something like that. Just like doing these basic things really well, like and like combinations of different types of exercises, and like seeing what works for you, seeing those short tutorials, use what you can, what works, and ignore the rest. That's a good thing.
Hello from Australia. Thank you guys for sharing your knowledge. You're the best. Your English is perfect, by the way. Thank you very much.
Thank you.
I was quite sure that nobody from Australia will turn or come to watch it, because you have like what is it, like 5 in the morning there?
Yeah, that's
4 in the morning.
Dedication for you.
Yeah, and you have also a sad day in sports. Your champ in UFC, Jack Della Maddalena, unfortunately, yeah, sad day. Hopefully I didn't spoil for anybody who's watching it like it after this, but yeah, sad day for Australia.
Your Spanish is also great.
Gracias.
Yeah, we are international men of mystery. Mysteries.
Bald men of mystery.
Yeah. Also known as NoHo Hank, according to some people.
I get numbness and pins and needles in my fingers during the night and more during the day. How can I tell if it's due to spinal stenosis, entrapment syndrome, or carpal tunnel syndrome? Well, to put it like Frank, if you want to know exactly what it is, then you have to go and get it assessed. It's really hard to test it by yourself. Where is the impingement, or if you have like spinal stenosis? Usually stenosis is painful when you move your neck and you get the pinching there and radiating symptoms, but sometimes it's not the stenosis, it's something else in the neck. So you need to get assessed and probably maybe even imaged.
I am super
Black Friday sales. Yes,
Ooh.
Yes, they are.
Yeah.
I think they are coming. We don't
do it.
Yeah, we don't do it. We don't like determine the price of our things, or we don't determine the sales or anything. It's all done by movement world. So, but I know that something maybe is coming on Black Friday. Maybe it's even now. I don't know when they release it. We just don't know. We make our courses. We answer to questions that people send, and then we also like do ads and stuff like that. But we are not like doing the marketing things, and we are just doing our own YouTube channel, and
I'm super lazy to keep up with my workout. Could you please make a follow along series of full body nerve release, myofascial release, or something along those lines? Our next video is about the same subject, that we have the neck myofascial line. It's for the lower body or the low back area, so that's something that you will probably enjoy if this is what you want. And also I have been thinking about different like content for our email subscribers, and one thing that I was thinking about would be like this tutorial info thing about this, like how to stick with your exercises, the like low key steps, how you can like incorporate more exercises to your daily life. If this is something that you would like to have or us to do, then you can comment down below or somewhere where there is text.
Holly from Australia said that not a great start to the week because there's Monday there. And they start the week with a loss. But not, you have still one champion, Volkanovski. So
Alexander the Great.
Alexander the Great. So you have that. Finland has nothing.
Maybe someday.
Maybe someday.
Probably not.
Probably, No, maybe.
Yeah,
there's up and coming stuff.
Yeah, this is such a small country that we have like few key sports where everybody like gravitates, like ice hockey and stuff like that. And then like these fringe sports like MMA is like there's not enough.
But there was a Makvan Amerikani, and there are some up and coming good people. And by the way, I'm originally from Estonia, but I've lived here a long time. But in Estonia also no MMA champs.
Have you not got sponsorship from Wilson tennis balls yet?
Not yet.
That's a shame.
Damn you, Wilson.
Maybe some other company and we will switch our game.
Maybe we don't have any sponsors. Nobody wants to talk with us. We haven't also reached out to anybody, so maybe that's why.
Why nobody comes to us?
Why nobody comes to us with money?
Please give money.
Please money.
Yeah. What do you think about those gadgets online that heat up a local spot on your back to favor circulation? You mean like these heat packs? Or...
Yeah, probably good. If you don't have inflammation in the region, then I guess they're good.
I think at least for relaxation, it's like really nice. Yeah. Not sure about if there is like super concrete like physiological benefits, local benefits. Maybe not. Yeah. Would love advice on how to keep my workouts. Yes. Okay. Maybe. Stay tuned. Maybe that.
Online courses.
Happens.
Yes, we have. We have 3 in English.
I don't know if this is the same person. I'm looking forward to the lower body course. I was actually talking about a YouTube video, if this is the same subject that you are talking about.
But there is a lower body course, and if you have lower back problems, then it's the sciatic pain relief course, movementworld.com. You can grab it there. That was the final one. Have we answered all the questions in a timely manner?
Now is the time for critique.
Yes.
How did we do?
Hit us hard.
We can take it.
We can take it.
Like
We will
good
cry.
boys we are.
We will cry a little bit, but we can take it. I will look forward to whatever you send through email. Thanks a lot.
Yes.
Thank you.
Thank you.
And we promise not to spam.
Yeah.
We hate spam ourselves, so.
Yeah. Our idea is that it will follow along the lines of our YouTube channel principles, philosophy, that it will be short, sweet, to the point, with maybe some bad humor here and there, don't know. And no spam, no, at least minimal clickbait.
Yes, somewhat clickbait.
You have
minimal.
to play that game if you want to get views and stuff, but yeah. And you can send us also email and messages suggesting what would you like to see on our channel, on the email list.
Subscribe if you haven't. Comment on our posts, comment on our videos. It helps a lot. And let us know what you think and what you want to see next. And it helps us to design.
We always have to think about what
videos,
we want to create. If you guys tell us what to do, then it's easier.
Tell us what we have to do, then we don't have to think.
Yeah, please.
Yeah, great, and thank you very much.
Thank you guys. You were
great,
like
patient,
super
Thank you.
cool, engaged with us. Yeah. I won't make you cry.
Thank you for everyone that watched this live, also every subscriber and everyone on our courses. You help us a lot, and we try to do our best, and
you get the worst.
Yeah, we will end this live now, and
see you next time.
Yeah, see you next time. And maybe we'll have a live soon, maybe not. We'll see.
We'll see.
But this was fun.
Yeah,
thank you.
I
have to go now to the camera to put it off. And
bye bye, Ludwig.
How to end this?
Oh no, technical.